I do want to welcome you to NYU Langone Department of Neurology Adult Clinical Neuropsychology Externship Open House, where we're going to take an opportunity to give you an overview of the training at our site and meet some of the faculty and hopefully go a little bit deeper than any brochure can so that you can have a good sense of the training at our program. And at the end, get a chance to ask us some questions. So my name is Dr. Chris Morrison. I'm the training director of the program. And as we go along, I'm going to introduce some of our other faculty. But first, I just want to take you through a little bit of the history of the NYU Neurology Neuropsychology. And then here's a little overview of the topics as they come in our open house. So within the Department of Neurology, there are many divisions, and you can see the Center for Cognitive Neurology. That's going to be the Barlow Center that Dr. Schulze will talk a little bit more about later on. We have the Division of Epilepsy, where some of us are co-located. And then, of course, we have existing within the organizational structure, the General Division of Neuropsychology, which includes all the neuropsychologists within the Department of Neurology. So as I said, Department of Neurology has a rather impressive and storied history with regard to the specialty area, at least at NYU. We have what could be argued the first neurologist in the US that worked and practiced at NYU. We have some very famous psychologists and rehab psychologists, neuropsychologists, cognitive folks who had psychophysiology labs. Hans Lucas Teuber. Of course, you all know Wexler. He originally it was the Wexler Bellevue, and so you all are familiar with Bellevue being an affiliated hospital with NYU, although we don't have rotations there. The Bender-Gestalt originated out of hospital affiliations with NYU. So a lot of involvement in psychology, neurology, neuropsychology, rehabilitation at NYU for a very long time. This is our current group of neuropsychology faculty. As I said, you're going to meet some as we go. Our pediatric specialist, Dr. Rosenberg, we will encounter through the course of our didactics and so forth. But as we currently don't have our pediatric rotation offered, she's not with us this evening. So just a little bit of a basic overview. So this externship is at the Manhattan campus. As you might be familiar, NYU has many campuses now, Long Island, Brooklyn, and so forth. But the position is fully in Manhattan. And we are currently offering 7 positions. That's our current cohort size, and it seems to be working out well for our flow currently. So we'll be accepting 7 matches. And the focus of the training here is really consultation and neuropsychological assessment. There's no intervention experiences, so if that's something you're interested in, this may not be an ideal fit. And by consultation, I mean consultation neuropsychology, which neuropsychology essentially is a consultative service. The training experiences are predominantly in person. We don't do remote testing. And may do remote feedbacks on occasion, but predominantly this is an in-person training experience. I left a little tidbit about how some of the feedbacks and so forth are conducted as regards to our pediatric track, just for when that might come back. But generally, you should consider this an adult training experience. We try to weave in work from home when it's possible, but we don't like to promise it just in case we can't guarantee it. So we don't want you to have the expectation that there's always going to be work from home day. But we do try hard to be efficient with your time. And if it's better to work at home and we can work it, that's what we'll do. Just a brief comment about the application requirements. You have to be enrolled in a doctoral program in clinical psychology or related. We would like a cover letter, a CV, two letters of recommendation, and importantly, a list of psychological and neuropsychological tests that you've administered or are familiar with giving. That information is very helpful to us in considering our candidates. And of course, this slide has been updated now because we do have the match coming this year, so that will be exciting. I'd like to take a minute to switch to one of my colleagues who's going to discuss a little bit more about the training activities at the Manhattan campus. Dr. Shahab, would you like to jump in?
Yes, thank you. So, my name is Dr. Safa Shihab. I'm one of the two neuropsychologists at the Barlow Center, which is one of the rotations that the externs at this externship rotate throughout the year. The other neuropsychologist being Dr. Scholze, who will speak shortly. So, I'll be giving a broad overview about the externship as a whole, and some finer details will be covered a little bit later on in the slides. So, as Dr. Morrison mentioned, this is a clinical neuropsychology externship, and you'll be rotating in an inpatient and an outpatient setting. Inpatient setting is included predominantly in the epilepsy center part of the rotation, which is the larger part of the rotation, where you see inpatients at the hospital on First Avenue between Kimmel and the older hospital. And some of these, I think some of the kinds of referrals that go through the inpatient unit will be covered shortly. So, but I'll be more broad. And there's also an outpatient component. Barlow Center is predominantly or only outpatient. And that will be covered a little bit too. You'll get an opportunity to work with multiple different supervisors broadly. Generally, it kind of depends on the days that you choose to be in the externship, but overall, you'll get the opportunity to work with several of us. At least, one or two at the epilepsy center, and one or the both of us at the Barlow Center. So that's one of the unique features of this externship. It gives you an opportunity to experience different styles of supervision and just get a kind of a broader, more well-rounded experience in terms of, different experiences and etc. You're generally required to be in the externship for 2 days of the week, 2 full days. You have to choose one of them to be a Tuesday or a Thursday, and that's usually because we have our externship didactics on both of those days, and so that gives you the opportunity to go to at least one of them in your throughout your week. And so the other day you can select as you would like. Overall, you could see around two cases a week, but you'll be responsible for one full clinical evaluation per week. And that means everything from reviewing the case. I'll be talking about your access to Epic in a minute. You're reviewing the case, discussing it, participating in the clinical interview, doing the full neuropsychological testing, scoring, norming, and things like that, and writing a full neuropsychological report, really from start to finish. Obviously, there's templates and examples, and that gives you a little bit of a structure, but you'll be writing the full report and getting supervision on that report. And occasionally, when the opportunity arises, participate in if the patients come back for a follow-up to discuss the findings. In terms of documentation, in addition to writing the report, there's no, epic notes or anything like that that you additionally have to do or anything related to billing. And so your predominant responsibility is writing the report. Our reports tend to be, that we take the modern, obviously, views of neuropsychology, where our reports are shorter. They're really catered to our referral sources, but also to our patients. So they can be anywhere from one page, for example, for some inpatient referrals where there's a quick turnaround. It's a medical case, and we'd like to give the report back to the referral source really quickly. And it's a very specific type of referral. That report could be a page. And generally, our outpatient reports are more towards the 3, 4 pages, not including the table where the scores and norms are. And another unique, if we can go to the next slide, another unique feature of this externship, which doesn't isn't really typically present in some of the other externships, is that you do have access and can learn how to use the electronic medical record to review patients' charts. You don't have editing access as an extern, but you can review their charts. And so you get a little bit of a training at the beginning of the externship on how to use Epic, just the general features of it. But obviously, with each different supervisor, you get a little bit more of a in-depth experience in how to review charts, what's important, what's not, and how best to utilize it and to benefit from it.
Hey.
All right. So I think I'm taking over next. My name's Dr. Avildsen. I work at the Epilepsy Center. I'm one of the neuropsychologists there. So we wanted to talk a little bit more about the types of cases you're going to be seeing while you're on our rotation. And I say a little bit about because you could see almost any kind of patient while you're over with us. So we see patients, adults. So youngest would be age 16 all the way up to the 90s. Our patients are coming from around the world to our center to get services here. So we have the benefit of seeing really an extremely diverse patient population, not only from various geographic backgrounds, but also socioeconomically and culturally. You will likely get the chance on one of our rotations to see somebody from a different linguistic background and work with an interpreter. We do that all the time. And in terms of the clinical presentations, we really see a wide range. So even though we're called the Epilepsy Center, we see all neurology referrals on the outpatient side and even on the inpatient side, which I'll get into a little bit more in a minute. We see not just epilepsy patients, but also cardiac referrals. Dr. Shahab was mentioning some of those shorter reports for cases where we might be seeing, a patient who's looking at getting a heart transplant, and we have to kind of give the team some information on whether or not they might have dementia within a very short period of time. We, in the outpatient setting, see all types of dementia referrals, movement disorders. So we see pre-DBS cases, we see tumor cases, you name it. We pretty much see it. So it's a really rich experience. And if there's something you're really particularly interested in seeing, of course, you're only here 2 days a week. So within the constraints of that, but if you're really looking forward to seeing a certain kind of patient over the course of your year, we would definitely try to keep that in mind and make sure you saw that kind of case. I think next slide. So as Dr. Shahab already kind of mentioned, our reports are written in the modern format. So for our inpatient consults, where there is a quick turnaround, you'll be getting used to writing even shorter reports. So it could be like 1 to 2 pages for some of these referrals for psychiatry, for disposition planning, or cardiac transplant or referrals. Some of these are good resources of that are listed here in terms of how to write reports in sort of this modern age of neuropsychology. That's there for your reference. And then in terms of our other reports, they're generally also short, as we were kind of mentioning. We're really writing to not only the neurologist, but also the patients. And Most of our patients are not going to sit through and read 30-page reports with lots of prose. They're not going to understand what that means. So we're really trying to target our reports to our referral sources and our patients and make them digestible. So it's actually sometimes more challenging to write in a more streamlined way. So you'll get really used to trying to bring out what are the key features that you're really trying to highlight and work on your report writing skills um, in that way. So, and then also at the Epilepsy Center, we try to give externs the opportunity to see some of the procedures that we do. So we still do WADA procedures. These really ebb and flow over the course of the year, but we do try when possible to get externs to be able to see one throughout their training year. And then we're not able to bring externs into the operating room for intraoperative language mapping, but when there are bedside language mappings that occur on your day of the week, we allow externs to come and watch those, and certainly want to provide them with that training opportunity as well. So in addition to like the really diverse range of patients that you're going to see, you also can have the opportunities to see some of these special procedures that are really unique to epilepsy centers. And while you're at the Epilepsy Center, you'll be doing a mixture of both kind of, if you look at the clinical rotations, both inpatient and outpatient. So it's not that you have like you're on inpatient for a couple of months and then outpatient at the Epilepsy Center, but rather when you're at the Epilepsy Center, you could one week be seeing an inpatient and then, the next week be seeing an outpatient. It really just depends on the flow of the referrals from the epilepsy monitoring unit and other inpatient referrals. And while you're seeing outpatients at the Epilepsy Center, you will see them with Dr. Morrison, Dr. Resch, and myself. And just also depends on the flow of the week, as well as the days you select may lead you to work with one supervisor a little more than the other, but we do try to give people experience in working with everyone as best as we can. And then when you're at the Barlow Center, you're going to be working with Dr. Schulze and Shahab, and I believe Dr. Schulze is going to take over speaking next more about that rotation.
Yeah, thank you very much. Hi, everybody. I'm Dr. Evan Schulze. As Dr. Shihab had mentioned, I'm the other neuropsychologist at the Barlow Center. And our Barlow Center, we're located pretty close to the Epilepsy Center. I think we're just about 3 blocks away. So when didactics are occurring on either a Tuesday or Thursday in person at the Epilepsy Center, it's really not too challenging to get from one location to the other. So we can accommodate that without issue. So the Barlow Memory Center at NYU, we're really a specialized center for patients with known or suspected neurodegenerative disease. So because of that, the patient population trends older. So nearly all patients that we see here are over 50 years of age. I'd say the modal age is probably about 60 to 65 in that range. And there's been tremendous demand for our service, especially with the now availability for monoclonal antibody therapies for early Alzheimer's disease to help slow disease progression. And Dr. Shihab and I have become kind of an integral part of the team in helping to assess those patients at the earliest stages of the clinical syndrome in Alzheimer's to help determine when is the right time to intervene using those disease-modifying therapies for these patients. So most of the referrals that we're receiving, if not all, are coming from our in-house providers here at 145 East 32nd Street. We occupy the second floor of the building here, and it's pretty unique in that our clinic for the Barlow Center, which is part of the Center for Cognitive Neurology, also houses our Alzheimer's Research Center. So there's a lot of crossover for patients in terms of research access, clinical trials access, and then clinical access. And I think it results in great relationships among us neuropsychologists with our neurologist colleagues. And these are cognitive neurologists that have specialized training specifically in neurodegenerative disease. in the diagnosis and treatment. And then we also have, being a multidisciplinary center, we have geriatricians and social workers and one nurse practitioner right now. So we're all really focused on these specific conditions. So not surprisingly, the common diagnoses that we're asked to aid in is somebody at that stage of a mild neurocognitive disorder, an MCI versus subjective cognitive impairment, or helping to stage in that progression from an MCI to an early dementia. And the common etiologies that we're seeing, Alzheimer's naturally, just given risk with age, vascular related cognitive changes, behavioral variant frontal temporal dementia, and other FTLDs like primary progressive aphasias, and Lewy body disease or dementia with Lewy bodies, and within that realm, Parkinson's plus syndromes like multiple systems atrophy or cortical basal degeneration. What's great for us too, from a teaching standpoint, is that many of these referrals that we get will already have had some degree of a neurological workup. And many of these patients are at the point where the neurologist is needing a little bit of assistance from neuropsychology in clinical management of the case. So because of that, we're going to have ability to review some neuroimaging together, oftentimes advanced neuroimaging, like an FDG PET study, or maybe even there's an amyloid PET study. And oftentimes there's genetic screening, like looking at ApoE genotyping or other types of genetic risk factors for things like frontal temporal dementias. Here at the Barlow Center, since we're doing briefer evaluations with our neurodegenerative population, these evaluations are typically about 2 hours worth of testing that we're doing with each case. So what we do, we have one day that's set up for one full day of assessment, and then a second day that we set up for scoring, supervision, and anything else that needs to be done on the case. Our assessment days, the days that we are in clinic. So I'm in clinic Tuesday, Thursday, Friday, Dr. Shihab Monday, Tuesday, Wednesday. So there can be opportunity for overlap on Tuesday. And when that happens, sometimes we join together and we'll discuss cases together just to get a little bit more exposure to some differentials in how we're thinking through our cases. You can go to the next slide. So at the Barlow Center, I think it's a pretty nice space. I think that we have pretty nice space for our externs as well, and our testing rooms. So we're not necessarily fighting for space. We have what we need, and everyone will have access to a cubicle with a desktop computer. We also provide remote access. That's not just Barlow specific, but through NYU, you can get remote access. Um, as far as caseload, so as I mentioned, being briefer testing sessions, what we do is on the testing day, we typically have our extern see the morning and afternoon case. So an extern would see our 9 a.m. patient and then our 1 p.m. patient. And these are 3-hour appointment time slots. So we typically allow up to an hour for the clinical interview or interviewing with collateral sources, plus in that time, some case conceptualization after interview, and then approximately 2 hours of testing. When possible, I like to do same day feedback and sometimes getting our externs rocking and rolling on that as soon as possible once they feel comfortable. Um, as mentioned, these reports, as previously mentioned, reports this is contemporary neuropsychology, so we're being brief. We're answering our referrals question. We're not writing the patient's life history. Um, and when the feedback sessions are not on the same day, I typically try to have the patient come back on a day that the extern that saw the patient would be able to still see the patient. I like the idea of being able to see a case through completion. Um, and in terms of supervision, I consider it to be continuous. It's kind of the moment we start talking about a case, it's collaborative in that way, in that we're discussing differentials. We're discussing what are relevant aspects of the patient's medical history. And then, of course, it can get a little bit more specific to when we're talking about the test data or test selection or pivoting midstream when we're doing testing, when we see interesting or unexpected performances. So I consider it supervision to be kind of continuously present, and it can be tailored to the extern's needs. Meaning that, say we have a case together, it's pretty straightforward, a worried well individual, and the extern feels comfortable that they can start working on the report without much additional supervision and in test data interpretation. I think it's okay for them to start working on writing that report without necessarily going through, test by test, how did the patient do? And then there's going to be more complex cases where we're going to want to sit down and discuss on the front end before writing, just to get a good feel for the overall conceptualization of the case and the direction that our overall impressions are going to be landing. So, um, so it's continuous. Okay, and I think that's kind of the sum of the Barlow experience.
Thank you, Dr. Schulze. I'd like to addend that everything he described about the supervision experience is not limited to Barlow. That's pretty much universal across all of us. So you can just generalize that to all the supervisors in this training experience. So I want to switch gears once again and have Dr. Abelson take you through a little bit of an overview of our didactic experiences.
Yes, so as Dr. Shahab mentioned, we do ask externs to be available on either a Tuesday or a Thursday as one of their 2 days, and that's because we have the extern tailored neuropsychology didactics from 4 to 5 p.m. on those days. And even though this is an adult externship, the didactics are shared between our center and the Child Study Center. So you'll get exposure to a range of topics that cover the lifespan and have faculty from not just the Epilepsy Center and Barlow Center, but also neurology in Brooklyn and the Child Study Center and our pediatric neuropsychologist at the Epilepsy Center, Dr. Rosenberg. So you get a really nice range of didactics from many different supervisors. In addition to didactics on certain topics, we also do practice extern fact findings as a group, which is a really wonderful experience to be able to do that in preparation for board certification, but you're going to be doing it with your fellow externs, so you won't be put on the spot alone, which you are in boards. So it's nice. It's a nice way to sort of dip your toe in that experience, and that's led by our fellows at the Epilepsy Center. In addition to those really tailored didactic experiences for the externs, we also have a plethora of different didactic opportunities through NYU. So there's neurology grand rounds every Tuesday morning at 8 a.m. that you're always welcome to join. The wonderful thing post-COVID is that everything is available online. So you're not having to kind of run back and forth between different sites. And you could always join these things as well if they're really of interest to you on a day that you're not even on site. So there's neurology grand rounds as well as child neurology grand rounds. There's also the Epilepsy Center specific journal club, which has different different speakers, not just from the Epilepsy Center, but also from across the country and different countries at 8 a.m. on Wednesdays. And as you can kind of see, psychiatry grand rounds and other experiences sprinkled throughout the week. Additionally, at the Epilepsy Center, we have our multidisciplinary surgical conference on Monday afternoons where we discuss the patient, the epilepsy pre-surgical patients with the epileptologists, radiologists and the neurosurgeons, as well as ourselves, are presenting data. So sometimes when externs will see a pre-surgical case, and we know that they're coming up for the surgical conference, we'll let an extern know so you can kind of see how that data is presented in that setting to everyone. And you're also welcome to join in general, even if you don't have a case kind of coming up. That's also available virtually as well. So lots and lots of opportunities for learning. And there are others that we get emails about that are not even on this schedule. So if you'll have an NYU email, and you can get emails for many different learning opportunities through NYU. I think that's it.
Hey.
Yeah.
Yeah, now we'll take you on a virtual tour. Uh,
Yes.
so
Uh,
I'll play, you talk.
Sure. So this is showing you some different workstations and spaces on our epilepsy monitoring unit. It is one of the most renovated portions of the hospital. It is very nice. As you can see, the patient rooms have views of the East River. And if they don't have views of the East River, you have views um, of like the whole downtown Manhattan. So it's really lovely, their rooms. This is where you'll be doing the testing. If you're seeing patients um, on the epilepsy monitoring unit, we'll be using kind of their little tray, like a table, and you'll get used to kind of testing in a patient room, which is a different experience. And yeah, so you can see the little tray there. Then on the epilepsy monitoring unit, we have different areas where the externs can actually write the reports. So there's these little work areas that are in the hallways that have really nice views of, again, all of Manhattan and or the water. Um, and you can see one of them here with really quite lovely windows. And then there's another example of a work area um, on at the hospital there as well. So in addition, I'm not sure whether we have a picture of it. I don't think we do, but in addition to these work areas on the inpatient unit, there's also a research room with a bunch of computers where our materials are housed, and you can kind of work there as a group as well. The really nice thing is that you're not going to be lugging materials back and forth between the inpatient unit and the outpatient unit. So we have everything in general that we need there. So when you do the testing there, you have, not only just the computers, but also all the testing materials there for you as well. And then this is an example of what a testing office that could look like that you're testing in at Charleston, which is the main place you'll be while you're at the epilepsy center. And again, so just a nice quiet room with all the testing supplies that you need. So, and then I'm over at the sleep center, and I don't think we have a photo of an office there, but also plenty of places to work, just like at the Barlow Center. So, again, you're not going to be assigned your own office. That's not really the way um, things work kind of anymore, but you will definitely have a space provided to you to work. And there will be computers available to you. And then on those, opportunities to work from home, if they're provided, or if you so choose and you kind of want to work on something while you're not on site, you will have access remotely as well through NYU, which is really beneficial. So we tend to like scan all of our patient data as soon as we're done scoring it. And then that way, if you want to reference anything anything from your case while you're writing it, it will be available to you from wherever you happen to log on. So you don't have to go back to the exact same spot, which is really nice.
Thank you very much, Dr. Avildsen. So those are the nuts and bolts. I want to run through a couple of quick details and then open it up to see if you all have any questions. So you probably all have this information from your programs and whatnot. I see that the portal is open and that people are already submitting applications, but the deadline is January 23rd. And of course, we're participatory in the Ninja process, so we'll only be accepting applications through the match portal. I've already mentioned the important things that are part of your application packet, and that includes a list of the psychological and neuropsychological tests that you've got experience giving. And we're conducting all of our interviews virtually via Zoom, and we'll, of course, again, you should be familiar with these dates. We'll begin scheduling on January 26th and be submitting the ranks on March 24th. So we'll see how this whole match process goes. So I want to thank you for attendance and